So we talked about it's like the giggle factor, like the whole. Hello, welcome to our newest episode of DocTalk, the show where we talk to a doc about what's in the news. This is a doc. I'm Lissa Klein, and this is Dr. Janet Choi. We're really excited to be talking today about rapamycin. A little disclosure. First of all, she may rap in a little bit, so apologies.
Not on camera.
A little disclosure that this particular topic is a pretty medical and clinical, and so we're going to be using some jargon. We'll try to create definitions and explain it as we go, but normally we're talking about dancing and twerking, and today we're talking among other things, and today it's really, really clinical and medical jargon. So fair warning, but I think you'll be interested. This has been in the news a lot lately. There was a pilot study investigating how repurposing low doses of rapamycin, which is a medication we'll talk about in a little bit, a drug that was originally used for transplant patients when you have a liver or heart or something else transplanted from another person, and that this drug was used to help with rejection of those organs, right? And the drug was found that it could delay ovarian aging in women. And so we're going to unpack the science behind rapamycin and ovarian reserve, what the study found, and what this could mean for future fertility and women's health.
Cool. Yeah, it's very intriguing.
Very
early stages, but intriguing.
Yeah. So we're going to jump right in. As I said, rapamycin was first approved by the FDA to prevent organ rejection. It was approved in the 90s for transplant patients. In high doses, it suppresses the immune system. In low doses, it helps with inflammation. It works by inhibiting a signaling pathway called mTOR, but a signaling pathway that regulates many cellular processes, including metabolism, growth, and proliferation. Proliferation is just like the rapid growth of cells. And it's not approved for pain or anti-aging, but some physicians prescribe rapamycin off-label with the aim of fending off age-related conditions. Yeah. That was a mouthful that went
That was
through.
Actually an encyclopedic sort of reeling off of details. I'm impressed.
Me too.
Dr. Klein.
Thank you. So first, one thing to get out of the way. What does it mean when someone prescribes something off-label?
So off-label doesn't necessarily mean that you're practicing medicine in the wild, wild west. It just means that you're using a medication for a non-FDA, so a non-officially FDA-approved purpose. So in the area of fertility, which we're in this room very familiar with, when doctors use, for instance, letrozole, aka Femara, which is used for breast cancer patient survivors, among other things, and use it for ovulation induction to help somebody get an egg to mature and ovulate so they can try to conceive either through intercourse or through intrauterine insemination. That's actually been very well described by our professional organizations and within our profession and used considerably as a method of treatment for many individuals, and that's an off FDA label application of letrozole. And that actually would be potentially, because I know that you were thinking, I could just see the thought bubble.
You read my mind.
Yes, I can read your mind because we're just so in sync, that in this kind of scenario, the insurance companies may actually cover, if they cover fertility treatments, letrozole treatment as well.
Yeah, another common off-label use we see in the fertility space is omnitrope. That's sometimes prescribed for off-label uses.
Yes.
Human growth hormone. And so sometimes off-label means your insurance may not cover it. May be the case of rapamycin, although we'll get into it, but I don't think it's being widely used yet.
But it's not like witch doctor medicine or like voodoo medicine. This is actually, there are indications for off-label use of certain medications.
For context, can you, before we jump into rapamycin, explain what is ovarian reserve, what is an egg life cycle from the time they're created to menopausal, and what are we talking about when we talk about ovarian aging?
So ovarian aging, which again, if you've been through the fertility experience, seen a fertility doctor, you're probably well aware because you've gotten this lecture from your doctor. People who are born with ovaries, so females for this conversation, are born with a fixed number of eggs. Typically, a newborn female infant has about 1 to 2 million pre-manufactured eggs in her, typically 2 ovaries. And we don't replenish our egg supply as we age.
Unlike men who create sperm.
Right. So this is, I tell people all the time, males, or people who are born with testicles, have no sperm when they're born. and then they hit puberty, usually in their teens age range, and it's almost like a hormonal light bulb and factory goes off in their testicles. They start making sperm from that day forward, and they keep replenishing their sperm supply. So whereas males will be able to frequently procreate using their freshly manufactured sperm into their 50s, 60s, and sometimes 70s and beyond, women typically have just a dwindling supply of eggs as we normally and naturally age because we don't replenish our supply.
So you're born with all the eggs you have, and you have the most eggs in your ovaries when you're actually in utero.
Yes.
And by the time you
like
are
6 to 7 million when you're like 25 weeks gestational age.
And by the time you hit puberty in like your 20s and 30s, it's already significantly reduced. And what does it look like at like menopause?
So at menopause, you're down to your last few hundred, if any, and those eggs, because they've been sitting in your body, and so most people, average age of menopause onset is like 50, 51. When women reach menopause, for all intents and purposes, you don't have any usable eggs left.
Yeah.
And your estrogen levels, because the active eggs, when you're younger, make estrogen, your estrogen levels come down, and you have all these symptoms associated with menopause. So it's frustrating, and well, I'm taking away your thunder, so you have at it.
Don't steal my thunder.
Yes, I will.
In addition to that attrition that we talked about, where eggs, you're born with a lot and you slowly lose them in quantity, not slowly, you lose them in quantity, you're also losing quality because of that metabolic activity that happens when egg meets sperm. And so not only do they decline in quantity, they also decline in quality in the same way like your skin and hair age, your ovaries age.
Right, and so this is a very hard pill to swallow, I think, for a lot of people who are trying to have kids with their own eggs into their late 30s and 40s, sometimes in 50s. Why, if I'm staying so healthy and I look so fit, like I have the physique of a 35-year-old, even though I'm 45, why aren't my eggs cooperating? And your eggs are on your own timeline. And so it actually has to do with those egg cells. Their meiotic spindles, among other things, are aging, so they're unable to divvy up the really crucial genetic material. So when egg and sperm combine together to try to create a pregnancy,
They like split.
yeah, the older aged eggs are just much less capable of producing healthy embryos, healthy pregnancies.
Yeah. So that's ovarian reserve. And how does rapamycin affect or is thought to potentially affect that process?
Prior to this interesting study from Columbia University here in New York City, there had been, I think, other studies looking at rodents, mice specifically, showing in studies that when you feed mice rapamycin in their feed or inject it, I can't remember the actual methods of administering rapamycin, but what researchers found was that those mice actually retained ovulatory function and their fertility into a later mouse age.
So they were ovulating later than you would expect a mouse to ovulate.
Right, meaning like not delayed ovulation, but they were able to retain ovarian function, mouse ovarian function, for a longer time span when they were given this medication, rapamycin. And there have been some like informal studies and reports of humans actually trying to take rapamycin to defer or slow down the aging process. Don't know how well that's been working, but there have been other areas of research looking at slowing down the aging process using rapamycin.
And they also saw that the mice had an increase in their pool of primordial follicles, or like the follicles available.
Can you say that again, please?
Primordial follicles.
Yeah, so it basically slowing down the emptying pool, the dying off pool of eggs.
Yeah.
So the suggestion there seems to be that by giving mice this, you are slowing down the loss rate of the eggs, which is inevitable. And so this research group at Columbia said, hey, why don't we look at using low-dose rapamycin therapy in willing candidates? So it's a randomized control trial, 35 to 45-year-old humans, females. And these candidates are being administered either a placebo, so a sugar pill, or a 5 milligram tablet, I think, of rapamycin once a week. Right.
And initially encouraging results, right? I also, by the way, learned when we were looking into this episode, and we're looking at it yesterday, that the mouse gestation period is 19 to 21 days.
I know. And the lifespan of a house mouse is like 1 year.
That's crazy.
Right.
Hello, and welcome to Mouse Talk. So, encouraging results for the researchers at Columbia who claim that rapamycin may be able to extend a woman's fertile years by up to 5 years. That's what the study showed. It's an ongoing clinical trial, right? And so it's not been like peer reviewed, it's not finalized, but what stands out to you about the data so far?
So again, it's small study numbers yet, and it's a pilot study. They're really trying to figure out, is there a lot of harm to the study participants? Should they be not even thinking about this because of side effects and health risks associated with taking this just way too much? And just to be clear, by the way, higher doses of rapamycin when given to transplant patients, and again, I'm not a transplant expert, I think you're not supposed to give it to liver transplant patients, but to heart transplant and kidney transplant patients. And I actually remember taking care of a few patients in my past who'd been on this medication during pregnancy. But in general, when people are taking those mega doses of rapamycin, literally like 2 to 10 milligrams a day, so they keep their transplant organs healthy, it can cause some pretty profound side effects and health risks, like changes in your blood cells, your white blood cells, your platelets. They can drop, and it can increase your risk for infection. It can change your lipid profile in a not very healthy way, potentially increase the risk for heart disease.
Lipid, like cholesterol?
Yeah, like cholesterol, I'm sorry. Cholesterol, triglycerides. It might also increase your risk for blood clotting. So these are pretty profound, serious side effects and risks, so it's not something to take lightly. And with that said, what the researchers, and correct me if your interpretation of the publications recently said this, what the researchers found were when you gave people these very low doses, 5 milligrams once every 7 days, there weren't that many reported side effects, maybe some canker sores or mouth sores. I don't know if there was anything else reported. But again, we need to learn a lot more about this before it's ready for prime time.
And how are they measuring ongoing ovarian reserve as through this test?
I think, was it measuring anti-Mullerian hormone, AMH? It's a hormone made by your small resting follicles in your ovaries, and so as your eggs age out, your AMH levels tend to drop. It's a blood test.
And a transvaginal ultrasound,
to look at the follicle count. And were they also looking at estrogen and FSH as well? I think that was listed. So some basic ovarian reserve profiling via blood testing and ultrasound.
So like I said, it's an ongoing study. We'll need to wait, it looks like about 2 years for the clinical trial to finish. Is that right?
Yeah, I think they're going to do the pilot study, and I think maybe they're going to kind of take it to the next level if things look appropriate.
And so once the results of this phase has concluded, what do you think the next steps would be? And follow-up to my question, how do you think this, or how do you see this drug being integrated into like fertility practices?
So once all of these drug studies, if it continues, show really promising results with minimal health concerns, I think the next step would be for me to see is, does it really impact and prolong a woman's fecundity? Is someone
fertility?
Ability to conceive with her own eggs. Is she, by taking this medication, let's say she can extend her age of menopause from 50 to 55. If she tries to use her 52-year-old eggs, are those eggs, even after she's taken rapamycin, are they still healthy enough? Right? So it's one thing to keep on having your menstrual periods and ovarian function making estrogen.
The quality piece.
Right, but does it improve the quality of those eggs to such a degree that you're able to get genetically normal, healthy embryos from those, as an example, hypothetical 52-year-old eggs for someone who took rapamycin for a couple of years?
Yeah, so if you're keeping the quantity of eggs but the quality is not improving, then what's the point?
Right.
Maybe.
Right.
So if you were a fertility patient today, would you go to your doctor and say, I want to be on rapamycin?
No, but I would say, hey, have you heard about this study? And then probably keep abreast of the news over the next few years to see how things are changing.
Yeah.
I do think it's kind of exciting. I know there's been a lot of other areas, solutions that scientists have been trying to look at to try to delay the aging process, especially at the ovarian level. And I think it's really exciting that Dr. Williams over at Columbia and his team are working on this. So.
Yeah, I like that they're continuing, Columbia and other fertility practices, especially academic, but really all of them are continuing to try to advance the field and find new ways of treating people, especially some of the most needing or deserving patients, right?
And really trying to improve and move forward women's health care.
Yeah.
Right?
I love it.
Yeah.
Go Columbia.
And actually, just a little sort of side note, not even a side note, this is like a major note. Even if this goes on to show that it delays egg aging out rates, but it doesn't improve egg quality, there may be some health benefits for women who are going through perimenopause and menopause, where if they can retain the ability to ovulate, have
good
their
point.
ovaries make estrogen, make all these natural hormones.
Which is protective for a lot of things.
right, cardiovascular
Yeah.
disease,
Yep.
metabolic disease, bone health. Right?
Interesting.
That could be actually highly beneficial as well. So I think that's another area to think about.
Yeah.
right?
So even if it's not promising in terms of fertility, maybe
Right.
it's promising in terms of midlife and menopause
Exactly.
care. Yeah. Oh,
Yeah.
I like that. I didn't think of that. See why we talk to a
See?
doc? This is why. So that's a wrap for today's episode of DocTalk.
A wrap on rapamycin.
A wrap on rapamycin. I like that. So we talked about the possibilities of rapamycin for, it's like the giggle factor, like the whole. We talked about rapamycin extending ovarian reserve and potentially delaying menopause. The pilot study, as I said, shows some promise, but a little early. And we'll keep you updated should we learn more.
Yes.
And as always, if you have topics that you would like us to talk about, please drop them in the chat or let us know. And share a review and subscribe if you found this helpful. We love Doc talking to you, and I love Doc talking to you.
Me too. We should just do this every day.
Can we just only do this?
Yeah.
Okay.
You guys write the script.
Thank you. Bye.